It's March 18th, and yesterday was St. Patty's Day. Hope you all wore green or got pinched. Today is a very special day in the medical community. It is the day where graduating med school seniors find out where they are going for their residency training. So, at least in the Eastern time zone, they're about to open their envelopes. So good luck to all of you med school grads. It's a long process, and congratulations on the past 4 years. We look forward to your entering the workforce as bright young physicians who really show great professionalism and compassionate care for your patients. Before July 1st, however, please enjoy some time with your family, friends. Make sure you do something that you wanted to do. Maybe go on a trip. Maybe eat somewhere where you haven't eaten before, like a Michelin star restaurant or something. Who knows? But just enjoy your time from now until July 1st, because when July 1st comes, you got to hit the ground running, and there will be a lot of patients in need of your care waiting for you. So good luck again to all of you, and I hope to hear some great stories. I remember when I matched way back when, there was a lot of emotion in that room because you're with all your classmates, your friends and family. There's a lot of happiness for thankfully most of our classmates. There are some people who were not as happy, but nevertheless they continued with their medical training and are very established physicians all across the country. We're very thankful for all of the hard work that you've put in and the stellar careers that you will have. So again, cheers to you and good luck again. We are doing a little select skincare discount promotion for the near future. So please text the office with the word puffy to receive 20% off select skincare products. Spring is coming this weekend, and so it's always a good time to level up on your skincare products, but especially now that the days are getting longer and the sun is getting more intense. And around this area, the cherry blossoms are coming out, so that's a beautiful sight. But we want you to have the best skincare regimen for your facial beauty so that you can put your best face forward. Again, text the word puffy to our office number 703-705-2100 and follow us on our Instagram and Facebook accounts. All right, we have a very special piece of news. We have a new member of our team. Her name is Tracy, and she will be joining us as the new office manager. So now we have a team of 5 full-time people, including myself, as well as our 2 part-time skincare estheticians. Again, whenever you visit our office here in Fairfax, we greet you with open arms, and we make sure that we do our very best to give you the best service possible. So again, thank you for your support, and next time you're here in the office, please say hi, especially to Tracy. All right, next thing, I did mention, some people who have come in the office say that either they or a member of their family is getting married. So there are a lot of mother of the brides, mother of the grooms, brides themselves coming to the office these days. We have a special package if you are a bride, even if you're a groom, and mother of bride, mother of groom. So we have a special skincare package here. It's been posted on our social media as well. Please come in a couple weeks before the big day so that you can give your facial beauty the glowing touch that it deserves. You want to look great for your photos, and we just want to help your facial beauty out for your big day. Our staff and our skincare specialists will be happy to assist you with the procedures as well as the products that you can take home so that you can have your best skin face forward for the big day. Okay, the other promo that we're running these days is a little bit of spring into beauty with filler treatments. As you know, filler treatments can be placed around the face and neck to volumize and contour your facial features so that you maximize the facial aesthetic that you bring in. So what we're doing is when you buy 2 or more syringes, you get $100 off each syringe. So if you buy some Restylane or Juvederm or Radiesse, whatever we may use it, it'll be $100 off if you buy 2 or more syringes. We're going to talk about lower eyelid surgery today. So last month, if you tuned in, we talked about lower eyelid non-surgical treatments, mainly filler along the under eye hollow. And we discussed who is a good candidate for that particular procedure. So today we're going to talk about surgery. The best candidate for the surgical procedure is for those people who have fat coming forward, and it's more forward than your cheek and more forward than the eyelid margin. Okay. So when we talk about surgery, we're talking mainly about the issue of fat coming forward. So this young lady, she's in her mid-40s, and she had concern about fat coming forward right there. Okay. So there are 3 kind of structures to look at. The first is the eyelid margin. So, sorry, I can't reach that high. So right under the eyelid margin, you have a support structure, and we're not going to violate that. Between the eyelid and the cheek, so between the eyelid and the cheek, that's where fat can come forward. Now you need some fat to cushion your eyeball when it responds to head movements. Okay, so when there's a drastic change in acceleration in your car, the fat in your eye socket is there to cushion your eyeball so that it minimizes the impact. So what we do is we remove a tiny bit of fat, and we can do it under local anesthesia here in the office. There are 2 approaches to removing the eyelid fat. One of them is through the pink of the eye, and that is the more common way that I perform the procedure. I will do that especially if you have good snapback on your eyelid. Okay, so when I do this, and the ladies are cringing because I'm touching my lower eyelid skin. When I do this, my eyelid skin snaps back. Okay? Now, over time, this snapback can get slower, and it can get not as robust. So in that situation, you definitely want to consider not violating this support structure, which is called your tarsus. So the best way to do that is to go through the pink of the eye and access the fat that way. Okay. The other way to do this procedure is with a skin incision. And we place the skin incision right under the eyelashes so that you cannot see it. If you have long enough eyelashes, and if you wear mascara especially, you really can't see the incision. So what you do is you go through that incision, okay, and you go this way through the muscle and you access the fat that way. Now this is a good way to have the surgery if you have extra eyelid skin, okay. With eyelid surgery you can remove fat, but you can also remove extra skin if there's extra skin, okay. I try to make sure that for people for whom I remove extra skin, that this eyelid snaps back strongly, because if you remove too much eyelid skin, what ends up happening over time is that it does this to you, and so the eyelid itself comes away from the eyeball and doesn't touch the eyeball anymore. That's a very tough condition to fix, and we call that ectropion, E-C-tropion. So for people who have extra eyelid skin and some fat, we can use the external approach. And so we'll show you some examples. So this lady again, she's mid-40s, and her eyelid bags are more along the inner and middle part of the lower eyelid. You can divide the lower eyelid into inner, middle, and outer parts. Okay. For some people, they have fat coming forward in all 3 areas. For this young lady, she had fat coming forward just in the inner and the middle area. So we catered the surgery accordingly. So this is her 6 weeks after the surgery. As you can see, there's no more eyelid bags, which is great. If you look at the next slide, this is the slide of her looking upwards. Now when you look upwards, it accentuates your eyelid bags. So you can see that more up in the top picture, but now when she looks up in the bottom picture, there's nothing there. So that's the beauty of lower eyelid surgery when done carefully and when done correctly. Next. All right, this is a lady in her late 30s. Again, this can happen to young patients as well as older patients. It's not just because of age that somebody might get eyelid bags. I don't think this is the only young person, right? There's an even younger person than this coming up later. But it can be due to what your parents gave you. You know, if your parents had it when they were young, you will probably have it when you were young. So it's neither this nor that. When it happens, we can treat you no matter what age. Okay? So her eyelid bags are particularly prominent. The other thing is that the shadow right below the fat, so the border between the fat and the cheek, is you see a hollow there or a shadow. Okay. Now, going back to last month when I said that people who have a big shadow right here are a good candidate for under eye filler, you could make the case that, hey, maybe this person would benefit from under eye filler. I will tell you that's very tough to, it would be a lot of filler for this valley to come up and meet the hill that's above it, and by the hill I mean the eyelid fat. Okay. Not to mention that when you put so much filler in there, it's more prone to the ebb and flow of water coming to and from that filler, regardless of how much water it draws in. Just the more filler you have there, the more likely water is going to ebb back and forth, so you have a less reliable, less consistent result. So for this lady, we removed the fat, but the other thing that we did was we relocated the fat to fill the relative volume deficit below it. So the infraorbital hollow, as we call it, or the tear trough, is a relative valley compared to the hill of fat right above it. So we use some of the hill of the fat to fill in the valley of the shadow below it. So this is her a couple months later. Again, pretty refreshed look, pretty even contours. There's no shadow where there was before, and there's no hill where there was before. This was all done through the pink of the eye because she had a good snapback and was able to tolerate the procedure under local anesthesia. This is a middle-aged man who had lower eyelid surgery before he presented to me. Now, his main concern was that he still had that baggy look, especially towards the outside. Okay, as you can see on both the right, but especially the left outer part of the lower eyelid, there's still extra fat left. Okay, now, was this done incorrectly at the time of this first surgery? You could argue that, but the other thing is sometimes the lower eyelid fat doesn't come forward until later on in life. So, you know, credit to the first person who performed his surgery. It may not have been an issue at that time. However, now that he presented to me, that was the main thing that he was concerned about. So again, for him, we went through the pink of the eye, through the conjunctiva as we call it, and we removed some of the eyelid fat, and now this is like 2 or 3 months later. He has much smoother contours. If you turn to the 3/4 view, you especially notice it right there. There's a lot of eyelid fat pouching outward, especially toward the outer third of the lower eyelid, and now the contour is much smoother. So this is a very young patient, all right? And she had had under eye filler before, but she didn't like the look of it. So unfortunately, I had to melt that filler treatment, and you melt it with an injection called Hylenex, also known as hyaluronidase. Okay? Hyaluronic acid fillers are made of hyaluronic acid, so in order to melt them away, you have to inject an enzyme that breaks down hyaluronic acid, which is Hylenex. So we did that in the office, carefully placed injections right along the border between the lower eyelid and the cheek, and we came back a few weeks later to do the surgery. Again, for her, we used the transconjunctival approach through the pink of the lower eyelid, and we got rid of that bump right there so that now it's relatively smooth. Okay. I will say that some people would look at this and say, you know, it looks darker. That is true. The transition between the lower eyelid plates and the cheek, however, is more smooth, and that's what she wanted. So that's a good result in our book. Okay. I'll put this slide up here just for our eye creams. My staff and I love all of our eye creams. This is the newest one that we have in stock. It's from a company called Skin Better. And we love especially their retinol and their eye cream and some of their serums, including the vitamin C. So eyelid surgery without eye cream is like buying a nice car without a car wash. You want to wash your car every now and then. So this is for your daily maintenance for your eyelid skin at home. Again, we do this in terms of surgery. We do this in the office, and people think, oh, you're going through the pink of the eye while I'm awake. It's more tolerable than people imagine. So actually people do very well with the surgery. At this time, we'll take any questions.
Okay, we have one question, Dr. Kim. What is the downtime for the surgery?
So downtime, since this is real surgery, sometimes there is a good amount of swelling. The swelling can kind of be noticeable along the top of the cheek. That's kind of the bottom of your rain barrel. You can see some red and some yellow, and then it kind of fades away over a week or two. The other area that you may notice some swelling is actually around the white of the eye, called the sclera. And so what you may notice is that it looks like a peeled grape. If you ever peeled back a grape before you ate it, it's kind of that transparent, round, bubbly look. And that can happen along the white of the eyes, especially if you go through the conjunctiva for surgery, because the swelling from the pink of the eye can move up towards the white of the eye. And that goes away in a week or two as well. Overall, I would say that you look very presentable at about the 2 or 3 week mark. You know, we have our pre-surgical and post-surgical things to do and not to do, things to eat and not to eat. So as long as you follow those, you have a very good chance of looking presentable at about 2 weeks' time.
Okay. Another question for Dr. Kim is, when do you suggest surgery over fillers?
So the simplest answer is when the eyelid fat comes too far forward, that filler can't even the valley to match the hill. Okay, and this will be most evident when we take your pictures and look at the side view. So when you look at the side view, if from the eyelid down to the cheek, the fat comes more forward, and I mean more forward than the actual cheek itself, and especially the junction between the eyelid and the cheek, that's when we would go more for surgery than for filler.
Another person asked, is there any skincare promotions that you're having?
So text Puffy to the office number, and we will have 20% off a limited selection of our skincare products. It might include some eye creams, so ask our staff for further information as well. We look forward to seeing you here at your next visit.
Okay, seems like there's no other questions. Any final comments, Dr. Kim?
Where's Nala?
Let's get Nala.
So Nala's 1.5 years now, and she's been with us since November of 2020. And She's not officially a therapy dog, but all our staff and our patients love her. She's our toy-sized golden doodle, and she loves hopping on the couch. They're right on cue. Oh, you slipped. Okay. Okay. All right. Did you miss Daddy? Okay. All right. Okay. I think Nala wants the attention now. So, again, thanks for tuning in, and please, you can text our office number in terms of what other topics you'd like to hear about in facial plastic surgery. If there are no inputs, I'll probably do something about rhinoplasty starting next month. So again, thank you, have a great weekend, and we'll see you next time.